Care for a person with ketamine addiction. Introduction. Let's talk first about addiction. Addiction is defined as a compulsive need for and use of a habit-forming substance despite its harmful consequences. Ketamine, a dissociative anesthetic originally developed for medical use, has increasingly become a drug of misuse due to its hallucinogenic and euphoric effects. While it has valid uses in anesthesia and treatment-resistant depression, ketamine misuse can lead to serious physical, psychological, and social consequences. Understanding ketamine addiction is crucial for providing care, support, and recovery strategies, especially communities such as here in Prince Edward Island, where substances misuse has significant social and health impacts. This report will examine the nature of ketamine addiction, its effects on individuals and families, and the role of resident care workers in supporting the recovery. Addiction overview. Ketamine addiction is primarily psychological rather than physical. Individuals may crave the dissociative and hallucinogenic experience it produces, leading to frequent use, tolerance, and difficulty functioning without the drug. Unlike opioids or alcohol, ketamine withdrawal symptoms are less physically dangerous, but the psychological dependence can be severe, making recovery challenging. Drug classification and reasons for use. Ketamine is classified as a dissociative anesthetic and Schedule I controlled substance here in Canada, meaning it is illegal to possess without a prescription. Recreational users often take ketamine to experience hallucination, dissociation, and feelings of detachment from reality. Reasons for misuse may include curiosity, peer pressure, escape from mental health struggles, or use within the club and party environments. History of addiction and diagnosis of ketamine. Ketamine was first synthesized in the 1960s. Ketamine was widely used as a battlefield anesthetic during Vietnam War because it provided sedation without suppressing breathing. By the 1980s and 1990s, it became popular as a club drug, known as Special K. Today, misuse continues to rise in Canada, particularly among young adults, even though ketamine is also being studied and prescribed as treatment-resistant depression under strict medical supervision. Anatomy and physiological affected by ketamine. Ketamine alters glutamate activity in the brain, disrupting memory and learning process. Long-term use can lead to significant cognitive impairments, including memory loss and difficulty concentrating. Chronic misuse is strongly linked to ketamine bladder syndrome, a condition that causes severe urinary pain, frequent urination, and bladder damage. The drug also affects the cardiovascular system, often causing increasing heart rate and blood pressure. Signs and symptoms of ketamine addiction. Common symptoms of ketamine addiction include confusion, memory impairment, and poor coordination. We have also hallucination and dissociative states, bladder pain, frequent urination, emotional instability, including anxiety and depression, social withdrawal and neglect of responsibilities, and risky behavior. Statistics here in PEI and Canada. According to national data from the Canadian Centre on Substance Use and Addiction, or CCSA, showed that approximately 1% of Canadians aged 15 and older have tried ketamine at least once. While data specific on PEI is limited, local health services report growing concern about ketamine use in nightlife and recreational settings. Hospitalization and emergency visits linked to ketamine misuse are increasing, particularly among youth and young adults in Canada. Effects on our body system of ketamine use or addiction. We have physical, like urinary tract damage, cognitive impairment, and risk of overdose. In emotional, we have mood swings, anxiety, depression, and irritability. In spiritual, we have feeling of disconnection and lack of purpose. And on mental, we have distorted perceptions, paranoia, memory loss, and hallucinations. Here are the risk factors for ketamine addiction. Risk factors include peer influence, exposure to club or rave culture, existing mental health issues such as depression or trauma, and curiosity or thrill-seeking personality traits. Easy access to ketamine also contributes to misuse. Here are the effects on family in ketamine addiction. Families of individuals with ketamine addiction often experience emotional stress, financial strain, and breakdowns in trust and communication. Parents or partners may feel guilt, anger, or fear for their loved one's safety. Children in affected household may experience neglect or emotional trauma. Here are the communication tools in care with ketamine addiction. Effective communication is essential in supporting recovery. The technique includes active listening, like allowing individuals to share their experience without judgment; empathy, like validating feelings and showing understanding; we have motivational interviewing, like helping individuals identify personal reason for change; and we have clear, respectful language, like avoiding confrontation and focus on support. Here is the treatments and treatment goals in ketamine addiction. Treatment for ketamine addiction typically includes detoxification and withdrawal management. We have cognitive behavioral therapy or CBT to address thought patterns. We have counseling and group therapy to build coping strategies. We have support groups such as Narcotics Anonymous. We have long-term goals treatment like achieving abstinence, repairing relationships, improving physical and mental health, and reintegrating into community. Here are the RCW roles and intervention in curing ketamine addiction. RCW play an important role in supporting the recovery. This includes monitoring physical health, particularly urinary and cognitive symptoms. We have providing emotional support through encouragement and reassurance, encouraging daily structures like healthy routines and coping skills. We have observing and reporting withdrawal symptoms or relapses, then facilitating family involvement in the care process, and we have advocating for professional medical or psychological care when needed. Here are the resources in PEI and RCW employment opportunities, where PEI offers several resources for addiction care, including mental health and addiction PEI, community mental health clinics and addiction service PEI, and RCWs may find employment opportunities in hospital, addiction treatment centers, residential programs, and community outreach services where they can support individuals recovering from ketamine misuse. Alright guys, this is the end of our video. In my conclusion, what I learned in this ketamine addiction research, that ketamine addiction poses a risk not only in our physical health, but it is also risk in our mental stability and our family well-being. Alright, as ketamine misuse is continuing to rise here in Canada, increasing awareness and providing care strategies is essential to build a healthier community. As an RCW, we play a vital role in assisting the individual through compassionate care, monitoring, and encouragement, ORR and DAR, to improve the quality of their life. Through proper communication, treatment, and community support, recovery is possible. Alright guys, that's it for today's video. Thank you for watching and see you next time. Bye!